So Donald Trump has appointed VP Mike Pence as the kind of head person to tackle the coronavirus epidemic, and this is obviously hugely troubling and disturbing on a lot of levels. We just have to go back to when Mike Pence was governor of the great state of Indiana, how he vetoed his own legislature when they were trying to provide access for needle exchanges, so people who use drugs were able to get clean needles so they weren't transmitting HIV. Mike Pence vetoed that bill that his own legislature passed, and as a result, like 250 people, according to this Yale study, were infected with the HIV virus because of Mike Pence's just totally retrograde and just views that aren't based in logic, fact, or compassion at all. And obviously, just look at it from a public health perspective, and he's obviously Pence very against science and reasoning and rationale. He doesn't even believe in the theory of evolution. He thinks that, what do they call it? Intelligent design. So, a very fundamentalist Christian way of thinking that, well, God just gave us all of these things. It wasn't through this process of evolution. So that's Mike Pence. This is the person that Trump put in charge of tackling this, huge problem that is the coronavirus. So obviously, Pence has no medical or scientific background. He doesn't believe in public health measures that save people's lives, that prevent them from, contracting HIV, like with the clean needle exchanges. He didn't support as governor of Indiana. Doesn't believe in evolution, like I said. And so this is the person, not surprising that Trump did it, but still obviously very disturbing and concerning when we look at just how deadly the coronavirus is compared to the regular strain of the flu. So I found this really interesting interview with Lori Garrett on Democracy Now! She's a kind of science writer, covers this type of thing. She was a fellow at this, I think, Center for Foreign Relations related to these kind of issues. So she was on Democracy Now! Today talking with Amy Goodman about this. So as of today, there's only 456 people have been tested in the U.S. to see if they do have the coronavirus. Just to put that in perspective, just in Seoul, South Korea, there have been 35,000 people who have been tested. So obviously just a hugely underwhelming response from the U.S. government with regards to this. And Lori Garrett was pointing out how there's kind of been two main ways that the coronavirus has been transmitted very quickly, either at religious sites or other kind of big gatherings of people, as well as at hospitals. And then Amy Goodman played some of the testimony from the DHS, Department of Homeland Security Secretary. That's easier to say for some reason. That they don't even have enough respirators for everybody in the U.S. to use. They couldn't provide any statistics or information on the coronavirus. This is the head of the Department of Homeland Security, as well as, so this was talking about before, the coronavirus itself is 2,000, 2,000s, 2 and 3 zeros times more deadly, more lethal than the regular flu. 2,000 times more deadly. So coronavirus has a death rate 2 to 4%, which is, okay, that doesn't really seem that high, but the regular flu has a 0.01 lethality rate. And this 1918 flu is the most deadly the human species had ever faced, and that had a death rate of less than 2%. So this is a very, very serious public health epidemic, and the response from the Trump administration has been hugely underwhelming. And some of the infrastructure that was put in place by the Obama administration to handle these type of outbreaks, they developed it around the Ebola virus, And basically, the Trump administration has totally just got rid of that whole kind of infrastructure. Now they're having to build it up in real time in order to try to combat the spread of this coronavirus. And it's just, we have just a bunch of buffoons in our government who, couldn't, I don't know, find their way out of a paper bag, basically, if they had to. Not the strongest metaphor or analogy, but it's like, Jesus Christ, this is 2,000 times more deadly than the regular flu. But Trump was more concerned with the stock market tanking than with taking this threat seriously. And one of the things that Lori Garrett suggested was that anybody who goes to a hospital, a doctor's office, who's suspected of having pneumonia, they should also be testing for the coronavirus in those settings, so they would be able to, potentially stop the spread of it in the hospital setting. So that's one thing that they recommended, as well as just having a more coordinated effort. Just kind of from their perspective, basically, all of the Trump administration's efforts have been very discombobulated and not very coordinated. So that was a couple of their suggestions, but not really, putting a lot of hope in Trump or anybody in his administration, for that matter, who are just, ideological or party hacks to treat this as the public health crisis that it is. I mean, 2,000 times more deadly than the flu. That's pretty substantial, and it's more deadly than the most deadly form of the flu that we've ever seen as a human species. So definitely some things to become concerned about here. And then Lori Garrett also made the point that, usually when these epidemics start, states will want to stop, trading or engaging in interstate commerce with each other. And it's just like this not in my backyard thing. So the global food system could be disrupted very easily by this. So the government should really be, taking a lot of efforts to stockpile food. And in the case that it does get to that point, and how China has already been doing that, just filling semi-trailers full of food, and, just having these big convoys that are available to meet the needs of the people. It's like we're just totally unprepared for this. And a big reason is, again, because Trump totally just destroyed the infrastructure to handle these outbreaks that the Obama administration had developed with regards to the Ebola. So I hope they get their act together, because this could get pretty serious, pretty fast if our global food system gets disrupted, if our medical supply gets disrupted, all of these things. And again, people in the United States don't have the luxury of universal health care. So anytime, a person who is underinsured or has no insurance goes to the doctor, they're potentially facing a huge medical bill, which will keep people from going to the doctor and seeking help. And then they might end up having this and spreading it and not knowing it, because they're scared to go to the doctor of what they might find out and how much it might cost. So just another reason that we should have Medicare for all. So just some thoughts. Share yours in the comment sections down below. Peace.